to our exam review. We're going to start in just one moment. Okay, I'm just going to grab some water for myself because I've been talking for the past little while. So just give me a second and then we'll start. All right, thank you for your patience. Sorry about that. I just had to grab some water. I didn't have a second after class. Okay, so we're going to do our exam review, and it's going to be for exam number 1, and I'm going to do it with a PowerPoint. I don't share the PowerPoint, but I will share my recording with your professors, so you will get to see that PowerPoint, okay, over and over and over again if you would like to. I will tell you the test is 50 questions. 5 questions are math, and you need a whiteboard. No paper will be accepted. Make sure you have your practice assessment done this week, which we will be posting for you if it's not posted already. And then you'll make sure to do that just to make sure all stuff is on a is ready to go. Okay. If you have any problems, Exemplify, I will post in my announcements and your teachers will as well. Okay, they'll post the number, call them. That's the best way. We, from our end, can only create the test. We don't really do the technology behind Exemplify, okay? For my review, I don't require you to stay on camera. It's up to you. You can if you want. You don't have to. I'm going to be sharing a PowerPoint, and it's going to be something that I made up based on the way I write the test, okay? So all the professors get together and we write the test, so we all know kind of what's on your exams. We don't necessarily know what's on the HESI per question, but we do know concepts. So just remember that as I'm going through things. If you sit through another review, please make sure that you listen for repeated information. That usually means that it's something important, right? All right, so let's take a look at my PowerPoint that I have for you. And I told my class, and I will tell everyone here, that the way I do exam reviews is I'm very clear, to the point. I don't do a lot of discussion with it because you guys have that all lecture, so you don't have to. So you're not going to hear me asking much questions. I may ask, give me an example of, or something like that. That'll help you guys when you're processing. All right, so first thing we look at is, what do we look at when we're evaluating a community? And that's all about community nursing. Remember, what are some of the things that we look at? We look at the health status and knowledge, right? So population health is the health status of a defined population of individuals. So we look at how healthy are they, how unhealthy are they? It's a big spectrum. We look at preventative health behaviors, things like playgrounds, lights in the streets, driving programs. Okay. So when we look at evaluating community, we have to look at all these different things. We are always sensitive to patient rights, right? So we know that until a patient is declared incompetent, the patient should be able to have the right to self-determine. Okay, so think about ethical issues that may relate to abuse and screening here, particularly with our older community, right? Our older clients, that always be concerned if you hear an elder person say, what about their finances? Do you guys know? When should you worry when they say what?
Like
They
if
don't
they're
know.
worried about how much their treatment will cost.
All right, so they're worried about how much their treatment will cost. That's kind of okay. They can worry about that. But what happens when they say, well, I don't know if I can afford it. My son does all the finances. That's going to be a big red flag to you. Okay, because that's one of the signs we see with abuse is taking over finances. So appropriate goals include for our older population, self-care capacity, managing chronic illnesses by themselves, preventing complications, delaying deterioration and decline, highest quality of life, right? We had two different types of nursing that was on one of your quizzes. Primary focus of community-based is the care of sick people. And then community oriented is based on healthcare and keeping everybody healthy. So we talked about Healthy People 2030 being an example of that community oriented nursing. And it's a nurse who is going to evaluate the risks of individuals, families, and groups. Okay, so that's going to be community oriented. There's two different topics, and I want you guys to know those for the test. We take a look at prevention. Our class spent a lot of time on this: primary, secondary, and tertiary. Primary is prevent, secondary is screen, tertiary is treat. How does this come along when planning care for a child diagnosed with a chronic condition? What do we know about that? Chronic condition, we need what? A lot of
Patient education.
Yeah, a lot of education, a lot of treatment, a lot of doctors. We talked in my class about that home, that health office that holds all the bills. That's called your home office. I mean, not all the bills, sorry, all the records for a chronic condition. When it comes to smoking and kids with asthma, how would a community nurse do primary and tertiary prevention? So maybe for asthma, what would we do for primary?
Educate.
Good. What are we going to educate on?
The effects of smoking on the child.
Good. Effects of smoking, healthy environment, right? And then if they have it, then they're going to do tertiary prevention. What kind of things do you do for asthmatics?
Medication regimens.
Good. Inhalers, the rescue inhalers, nebulizers, all that good stuff. Public health is going to focus on all this: disease prevention and health promotion. Remember, with our tertiary, we're trying to make it so that they don't have worse side effects. Okay? They have a condition, but you want to make sure it's not worse. We had a chapter on insurance, but I want you to know about Medicare and Medicaid. Two different federal-based organizations. Medicare helps those 65 and older, and Medicaid helps those with low income levels, and those are that are classified to work or disabled. Both are federally funded, but I want you to know Medicaid is run by the states. Okay, so the states have a say in Medicaid, and Medicare is federal, but both of them are federal. Medicaid, where you get the aid for those with low income. We know we have two healthcare systems. We have private healthcare and we have public healthcare, like Medicare and Medicaid. There was a section on Affordable Care Act passed by Barack Obama to help people access healthcare, increase Americans who can afford healthcare, increase quality and lower costs. We do know, and we've looked at our health determinants, our social determinants of health, that healthcare costs in the US are higher in our country, but indicators of health are not great. So what does that mean? We spend a lot, but the outcomes aren't great. Okay, I do want you to know that. Any questions on the Affordable Care Act? The goal was to get more people to get health care. Okay, it's now been altered and changed, and government's done all kinds of things, but just know about that Affordable Care Act. School nursing, that was a chapter you guys had. I didn't present much in this in my class. We have I am a current school nurse, so just I know some things about school nursing if you guys have any questions. But primary, secondary, and tertiary, we do a lot of that. What are things like when we see a patient, we're going to think ADPI, priority and interventions. What do we worry about? Which patient are we going to worry about the most? The one who falls and hits his head, the one who's asthmatic having an asthma attack, or the one who has a rash from medication?
Asthma.
Asthma.
Yeah. Remember your ABCs. So any ailment, when you're comparing them, always remember ABC triumphs. Okay, so even if, you know, they fall and they hit their head, you're going to look for concussions and things like that. But your priority at this point is having the kid breathe, because if he doesn't breathe, it doesn't really matter if someone has a concussion, right? All right, two things we did in our looking at families. We have that genogram, which is the genetics of a family. How does that impact health? You know, genes is a big thing nowadays. And then we have our eco maps, and that's going to be where we make maps of who are people around, like what are their relatives and neighbors, where do they go to church and school. Why do you think that's going to matter where they go to church and school?
Like if there's like an outbreak of something.
Good, an outbreak. What else?
Influences
Also
on
shows like any
behaviors.
support they have.
Good support. If there's an outbreak.
Available resources in that area.
Mm-hmm. Yeah. Do they have resources? Do the church have resources? Does the school have resources? Good. All right, Healthy People 2030 in schools. Please do not memorize this. I just want you to have an idea of what's going on. We're trying to like really prevent health problems, violence, suicide, tobacco use, alcohol, pregnancy, STDs, obesity, vaccination coverage. We're trying to get up there. And those kids with asthma, this is a big one. We're trying to reduce the number of school or work days that kids with asthma are missing. Okay. So you're going to teach the parents when they need to keep them home and when they don't, right? We have some acts that help us with public health. We have our FMLA, which is Family Medical Leave Act. What does that do? Anybody know?
It allows a person to take time off if there is like a family medical issue that needs to be attained to more so than what you might have in like PTO or vacation time.
Good. And what it does, it guarantees you'll have a job when you come back. It doesn't guarantee you'll have the same job, but it guarantees you employment when you return after a maximum of 12 weeks, right? And usually it's not paid, but that depends on your company. You can get supplemented by the state. We have the World Health Organization, who helps regulate worldwide events such as our pandemics. We have the American Disabilities Act, which was passed in 1990, providing protection against discrimination to millions of Americans. We have our QSEN, which is our Quality and Safety Education for Nurses. This is not a federally mandated organization, but it helps with all this good stuff like quality improvement, evidence-based practice, computers, patient safety, and patient-centered care. Evidence-based practice, we know, is use of best evidence in making decisions about the care of individuals. So it's important to figure out why you're asking, why you're doing the research. We use clinical trials, okay? And so our systemic reviews are at the top. Our anecdotal and expert opinions are at the bottom. I want you guys to know these different types of studies. That's in your book, your qualitative, case-controlled, quasi-experimental, and non-randomized. And that's about it on evidence-based practice, I think. All right, we have an understanding. Why would a nurse choose public health? That gives you a lot of autonomy and independence. Medical homes, we talked about this with the chronic illness. When a kid has a chronic illness, they're going to have a medical home. It's a doctor's office that holds all the information about that patient, so that when something happens or they go to the hospital, you can call the one place and find it. We've talked about this, and I emphasize it again. Please know the difference between community-based and community-oriented nursing. And base means there's a base. Patient has something going on, it's got a base to it. And oriented is more about taking care of the community as a whole. All right, vulnerable populations and our health disparities. Sorry, this is so small, but this little box moved. All right, so health disparities, our largest impact is economics. Higher chronic illness less follow-up with our vulnerable population. We see our 7 factors that worry us: income and social status, education, physical environment, social support networks, genetics, health services and access to healthcare, and gender. We know men and women get sick from different things all the time. We have our vulnerable populations, which is a group of this population that is more likely to develop health problems as a result of exposure to risk or to have worse outcomes. That could be environmental, it could be social, it could be personal, it could be biological, could be genetic, right? We look at our primary goal of public health is the prevention of disease and disability. Gabriella, sorry about that. So sorry about that. Public health. What does public do? Primary goal of public health: prevention of disease and disability, promotes independence, population focused practice, creates health standards. Population of the world is increasing due to increased fertility rates and decreased mortality. People are living longer due to our advances. We know with our health disparities, I'm emphasizing this again, our largest impact is economics. We see higher chronic illness among our vulnerable populations. Healthy People 2030, we talked about, I will re-emphasize. It sets national goals and objectives for our evidence-based goals. Family was this week's reading. Know that family structures change over time. There's no right model. Each family is unique. What are some characteristics of healthy versus unhealthy? Functional versus dysfunctional? And know about our delegation and prioritization. What is a family crisis? You'll see this question. Family crisis occurs when the family is not able to cope with an event. Like, I can't do this. I just can't do it. That's going to be a family crisis for you. We have home visits. Home visits are important because it lets us see our families in the home setting, which is the best setting you could be in. Assessments should be interactive. Know that they are evaluating, as the nurse is evaluating the family's evaluating the nurse too. Too much disclosure from the nurse, not so good. Slow it down, take time, build some trust. Before your assessment, you're going to review what's being assessed and why, the preferred time for the visit, the purpose of the visit, and try to have the whole family there. Okay, this is all this week's reading. Review importance of age-related concerns. I went through this with my class with our infants. We worry about SIDS and abuse. What is that age that is the highest rate of abuse?
Extremely young, extremely old.
So it's going to be your 1-year-olds is your highest rate of abuse. And we talked about why 1-year-olds. What do 1-year-olds do?
Cry.
Yeah. Yeah. They cry. They don't know to do anything else, so they just cry. And so you never get an answer when you say what's wrong. They just scream louder, right? So that's why it gets frustrating for parents, and you'll see abuse there. Children know environmental things you look for on a playground. And we talked again about a medical home where all their information is kept. With adolescents, we worry about car safety and suicide. With our risk assessments, young kids, what are we going to worry about? Do families talk about drugs and alcohol when they're young? Because that's a primary prevention tool. Gun safety, make sure you either keep it away from the house, store it safely, make sure you don't mix drugs and guns. And last but not least, our school nurses. We treat emergency medical needs in schools. We teach injury prevention measures. We also diminish environmental risks through education. So remember, these are all 3 things that a school nurse does. Okay. And I think I have one more slide, but it might just be my references. Oh, nope. I have one more. Ethics and law with nursing. Please understand that ethics, we must follow ethics when we practice as nurses. It's going to really deal with moral dilemmas. Know our Nurse Practice Act. Varies state to state. It tells you what you can do as a nurse and what you can't do. It protects the public by setting qualifications. What's the point of the Nurse Practice Act? Does anyone know?
To protect the patients.
Yep, exactly. The goal is to protect the patients with our Nurse Practice Act. Okay. So I covered a lot. I know I do it quickly, but I do that intentionally because I don't like to draw it out too long. Are there any questions about the study guide, the test, the exam, what you need, what you're gonna do? No? Okay, I'm gonna be doing a posting and I will share it with your professors. They will post it as well to you. So you can watch this YouTube anytime you would like. And with that, if there's no questions, I'll let you guys go and have a very good night.
Thank you.
Have a good night.
Thank you.
Do you mind taking a quick question for me, please?
Sure.
I moved from a different class into your class,
Mhm.
and I went to the announcement and I downloaded your recording,
Mhm.
and I realized it could be slightly different from what you covered in class. Is that true?
It's not going to be exactly the same. The reason I give you that recording is so that you guys have information to base your reading on. Hold on, let me just